key followed by pound. You have not entered any numbers. Please re-enter your meeting ID followed by pound. You have not entered any numbers.
Hello, I see we have people here early with us. Are you able to hear me?
Yes,
Beautiful.
I
Yes.
can
Thank you
hear
so
you.
much. And I can hear you. I'm so happy. Okay, good. I am in a different setting today. I'm in a hospital. My husband's in the hospital, so I'll be was able to join this way. Found a good place, cozy spot to do it from. But different setup entirely. So at least we got that far. If everyone, as you come in, go ahead and in the chat, put in your name and uh, something about you. It could be an organization you're with or a committee that you're part of, uh, or if you're a guest and you have an interest in the COC, that's beautiful as well. Okay, Gary says I'm breaking up a little bit. How does it sound? Okay.
You sound fine on our end, Sherry.
She just says that. I'll make sure to project.
Okay,
You do sound good.
thank you.
Both of you are in cahoots. And so we do have some slides that you know about that, right, Alicia, for the strategic plan.
Yes, it's in the materials file.
Okay. Okay. Oh, great. We have Volunteers of America in Florida here.
You certainly do.
Glad to have you. Thank
We're
you.
here. Thank you, Sam.
Oh, there you are. Hey, Janet. Nice to see you.
Our love and
We're
respect
here.
to all of you for this madness. Oh my goodness. I'm so sorry.
Oh, the HUD, the NOFO. Yeah, yeah,
Sorry about that. But
yeah.
this too shall pass, right? Not our first
Yes,
rodeo.
it's no, it's been a year. So, yeah,
We'll be ready to strike back.
that's right. That's right. It's more practice. Arrow, I received your message. I apologize. I'm not responding just yet, but I figured you were out then.
Yeah, I apologize. I couldn't
It's
remember
all
if
good.
I RSVP'd and let you know it's been a whirlwind.
You're fine. I haven't, I was telling everyone the beautiful, soothing background behind me. I'm in Morton Plant right now with my husband. We've been here overnight, well, since yesterday afternoon. And we kind of knew that was going to happen. Um, but we're not quite sure how long a stay this is going to be. He went for about 7 years without, it was a good stretch. So we're hoping this is a short saga. Very, 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 very brief sequel.
So too. Sorry to hear.
Mr. Froze. How about your sound on here? Okay, I don't know why that happened. Mute your mic and see what happens.
And we can hear you. Are you able to hear us?
And we can see you,
And we can see you.
Patricia.
That would have helped, huh?
I don't know why that happened.
I can hear you. Can you hear me?
Yes.
Okay.
Yes.
Okay,
And
great.
we
You sound great.
Yep.
Great.
Okay, great. Thank you.
Perfect.
Okay.
Hey Gary, I see your mouth moving, but we can't hear you. You're muted. Hi everyone.
Hello.
Hello.
Hey, we'll just get a couple more seconds. I'm reaching out to a couple people to see if they're coming in.
Hello.
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 Okay. Okay. In the interest of time, I think we should just go ahead and begin, and then we will see if our special guests will show today. I'm Sherry Holtzbacher with the Homeless Leadership Alliance, and this is our general membership meeting. Some of you, I see some newer faces, and I see many, many longtime friends who have been around much longer than me. And so, as everyone is introducing themselves in chat, there are some introductions being held there. We have some HLA staff. We have folks from various providers and partners within the COC, and we have some guests as well. And so, very excited to see new people coming and who are interested in the work that we all are very passionate about in reducing and ending homelessness within Pinellas County. I am going to just jump right into, for those of you who do not know, the HUD Notice of Funding Opportunity Update. So we have lots of things that have been happening. This year has been a very different year from previous years, for sure, at least in the last since 2013. And so we were able to, through 2025, beginning of 26, there were a few versions of the COC program, Notice of Funding Opportunity, that the HLA applies for on behalf of the COC and Pinellas most every year when it comes out. It's a very long process. Oh, it's an intense process. It is a process. So we create scoring tools, requests for applications. Local providers then submit those applications, and the COC, the executive committee, appoints a review and rank committee to meet. That committee then reviews all those applications, scores them, meets for deliberation that's public. And I'll tell you that every COC is very different in how they operate in their process. So ours is a public one, and we held those deliberations July 31st, so we could go Friday, and actually went very smoothly, especially for a year where we've been talking throughout this year about all the changes, the policy and priority shifts within HUD. And at the end of that, you know, I left Friday, and I think many other people did too, thinking we knew that it was going to be difficult. very hard work. Lots of very strong applications were sent in. We had new agencies submit as well. Definitely different, much greater variety of project types were included. And what we ended up with was something that looked very balanced within the CoC portfolio. Something for people who needed transitional services, people who needed behavioral health or street outreach with significant behavioral health needs, people who needed to maintain their permanent supportive housing or have those units available for folks who do need that as well. And of course, we maintained the infrastructure. And so that was kind of exciting. And this Friday, today is Tuesday. So last Friday afternoon, a federal judge did vacate that NOFO. HUD later acknowledged, I believe it was yesterday, acknowledged that the NOFO is no longer active, that the deadline of August 26th no longer applies, and we are waiting on next steps. And so for anyone who did apply, we are still holding on the applications. I really can't answer any questions around what happens next. There are various interpretations of this. It could mean new NOFO after a procedural process is done. So basically, it was based on procedural grounds. So there was not enough, according to the judge, enough time given to public comment for the changes that were made. And so that was the violation that the judge found. And HUD may appeal, but ultimately this NOFO is set aside. And so a new one would have to come in. Congressional action could take place just like it did last year, do renewals all over or not. We don't know yet. So as we are monitoring that and as we find out more, we will definitely make sure everyone is aware, especially our providers, the leadership board, and we'll provide regular updates to the CoC as well. There were also, though, it being a very interesting summer, not only did we have that NOFO going on, we had two more. So there were three NOFOs that came out fairly consecutively. One was a 30-day turnaround. That was the CoC Builds NOFO that's intended to rehab or reconstruct. It's a capital project for permanent supportive housing. And HLA did submit an application on behalf of the CoC with one project. And then also we have the Youth Homelessness System Improvement Grant, which is a planning grant, and that was submitted last night by HLA as well. So it's a pretty strong application. It's intended to help set us up for a youth homeless demonstration project and make sure that we don't have a lot of data on young people. And when I say young people or youth and young adults, I'm talking about people 25 and younger, who could be parents, they could be singles, but they are young and they are experiencing homelessness. And we know that population, we may not find in a PIT count. We may not we may not meet through a shelter. There are other ways that they need a special attention. We need to make sure that we're partnering with the right people and the right organizations that are youth serving and beefing all of that up. And so the fact that we don't have data doesn't mean it doesn't exist. And that is the point of this application, is to have funding to work on our coordinated entry system for young people, work on that assessment, work on creative ways that actually meet people where they are. And fortunately, we did a survey. We received a lot of responses for that. We also had a focus group with young people 25 and younger who'd experienced homelessness, and very excited about that participation. So that just made it even richer. People who are experiencing it or have experienced it were involved in the shaping of that application. And of course, there's a youth leadership component if we do get the grant to continue as well, and even some employment opportunities. So stay tuned for that. We hope to hear good news. So those are the three. And I just want to open it up very quickly for any questions around that process or those NOFOs. Okay. I'm going to scroll up so I can see faces. There we go. Ariel.
Just curious if you could share a little bit about, so the current funding expires at what point for projects, for example, that are already funded through existing funding, like that would be affected if the renewals are delayed?
Good question. The way that HUD directly contracts with the projects and the agencies. So for instance, HLA and CASA, all of HLA's projects and they begin on October 1st of this year and end September 30th that were already renewed. Like we just signed the contract yesterday, signed the contract for all those 2025 renewals. So the numbers that the FY doesn't matter. It varies. So ours goes from October 1st, 26 to September 30th, 27. I know many of CASA's does as well. And then Boley has the first project that ends, it would be January 1st would be, or December 31st would be the last day. They are funded through. And then there's various points throughout with the different projects. So that's really between the project and the and HUD and how they set that up. So it's rolling. Now, Congress did say that HUD had to make awards by, I want to say it was December 1st. So I don't know. That's where the question is right now. Is if HUD is required to make awards by December 1st, but the NOFO did not go through, then what? And so that's what we're waiting on to find out what happens. And I also, since Arrow raised a question, I want to thank with all of that work, Review and Rank. Arrow was on the Review and Rank team committee. April Lott was the chair. There also Dominic Randall, Avery Sliker. So the four of them were on the team. And that means that we have more people in the pool for Review and Rank, but they had completed all the scoring sheets, reviewed a lot of applications, and it's pretty intense work. And so I want to thank them for that. They had excellent discussion during deliberations. A lot of thoughtful questions came out of that. They interacted with applicants too to ask questions as well if any changes were being made. And I also want to thank the HLA staff there, Tony rocking that spreadsheet. That I had that job before, and it is the least favored job, I will tell you. And he did it wonderfully. So really appreciate that. And of course, everyone behind the scenes putting the lot, Cindy, Alex, Alicia, Imani, so that everyone is involved. It is a very big effort to put one of these on. And I'm really proud of how everyone did that between the CFC and the HLA. So thank you. And I hope that work doesn't go to waste. We still see HUD's going to maintain priorities the way that that's the way we can move forward. And we can take anything that we learned from this last process and apply it to the next when it comes, or we'll just have to see what HUD says. Janine? Hi.
Sherry, I just had a quick question for you. At one point, you said that the federal court had vacated the NOFO, but then you mentioned a couple other NOFOs that were going through. So can you just kind of explain the difference between those, just for folks to kind of understand? Because we're using the same acronym and saying some are on hold, but some aren't.
Yes, thank you, Janine. So the CoC program, NOFO, that is the regular NOFO that I call it the big one. That's the regular one that comes out every year, except for this. Look, 2024 was supposed to be for 2 years, and it ended up being for 2 years, but that wasn't really the experience. There's a lot of off and on, up and down last year. So that one covers whatever the CoC priorities are. And certain project types are covered in that. HUD gets to decide that. And then the CoC decides, who are our good performing renewal projects, where are our needs, where are our gaps. We find those out when we do that gap analysis and the PIT, data analysis. So that's what that one's for. And it has covered permanent supportive permanent housing and projects for domestic violence, so victim service providers were able to apply. for rapid rehousing, transitional housing in that space too. And of course, for coordinated entry and HMIS. So that's our information system. We know over the last year there's been some changes, and so we've had added street outreach, standalone services, coordinated entry for domestic violence, and also transitional housing to the mix as potential projects that could be funded. And it has been, I believe, since 2013, like since transitional housing has been as a project for a regular COC program, really prioritized. So that was new. For the other two, though, so the COC builds, that first came out in 2024 in the fall. And then then we actually did put out a competition for that one. We didn't receive any responses to it. There were other COCs within Florida that did submit, and of course, across the nation, it's much more competitive. So there were only so many projects that were going to be accepted. The regular NOFO, all COCs have a general, like, your first 60% or 90% or whatever it is in renewal. That's not competitive, and the rest is nationally competitive based on your scores in the application. So for the COC builds, it's very competitive and based on many different factors, but that one is just for capital projects or rehab projects for permanent supportive housing. And then the youth one, of course, is just for youth, and it's been several years since a new project has been accepted or a new announcement has been made and that funding been made available. So we decided we needed to go for it. It was a big lift taking on 3 at the same time, but we really needed to take the opportunity when it presented itself. And those two, the COC builds and the youth NOFO, we've not heard anything about those yet as far as, there has been no finding on those yet. No, everything they have been submitted and there's no court action has been made. So.
All right. Thank you.
Thank you. Any other questions?
Hey, hi, Sherry. This is Deborah Fix Sanders. I don't have any
Hi.
questions. Hi. I was on earlier. You just didn't see
I
me.
didn't see you. I'm so sorry.
And no, that's okay. I just wanted to say hello to everybody and welcome everyone. And I don't see any other COC executive committee members on the call, but I am honored to be here and I'm looking forward to hearing the presentation that Avery and Miss Helen has for us this evening.
Yes. Thank you, Chair Fix Sanders. I'm like Chair Council Member Fix Sanders.
What a title.
So now we have, I almost did do the whole hyphenation with my last name and realized that would be ridiculous. I can't even put my full name on a credit card already, so we're good. I've tried. So I'm going to move on to strategic plan, and then so we can pass it on over to our special guests, who are COC members, very active everywhere, and they're going to be talking about a special program. So with St. Pete. So strategic plan. Well, the COC strategic plan was passed by the leadership board back in July 11th, way back when. Been less than a month now. And this has been a process. We had over the year, we have a year-round cycle where we collect data. There are reports that go to HUD. We have several reports that go to HUD throughout the year and to DCF. That's the Department of Children and Families, but with the state. And we do a gaps analysis that's kind of contained within the point in time count report. Like I say, often the point in time count report that Dr. Freeman, the researcher and author that we contract with, and who is also a COC member and very active, that report is special to Pinellas. The reporting that we send in to HUD and DCF, that is what's required. And then we take that, and our HMIS team and our pit count team internally, as well as Dr. Gerhardt, go through and then really dissect all that information to pull as much information as we can, and also to come up with recommendations and to find areas of strength and areas where we could have improvement or gaps. So all of that is brought together. All the surveys that are sent out throughout the year were pulled together and we contracted with Stephen Ferrante. He's a strategic planning consultant who came highly recommended. And he was able to go, we went through these different phases, and we could just move on to the next slide. We went through these different phases between April and the end of, well, actually began before April, but through the end of June. And he was able to collect 31 source documents. Those are those reports that I'm talking about, where we shared a lot of system performance measures and all those other reports, so he could analyze that. He did electronic stakeholder surveys. So we sent out surveys. We pushed those out across the COC, and previous members and close allies, anyone who was connected with the COC at all who could give us feedback, received that. And there was a survey for everyone. There was also a survey that Gary Small worked with Stephen to come up with for people with lived experience. So we sent those out as providers. Of course, the Lived Experience Advisory Committee was given opportunity to complete those as well. And and then there were also key informant interviews. So those are interviews by system leaders to make sure that everything was rounded out, and those are a little bit more in depth. Out of 10, 9 were conducted, so there was a 90% response rate for those. All that information came together, and then there was a strategic planning work group that met 3 times. And I was part of that, so I can say, and many of you were also part of that as well. It required going over the information that had been collected and put into themes. And then we had our small group breakout sessions, and we came up with different strategies and actions associated with those. And then Stephen put them together, showed them to us, and we finally agreed on a good draft that was then sent on to the executive committee and the COC board for approval. Some of the strengths of the COC that were revealed through data and the surveys information collected was leadership and organizational capacity. That we have we really do have a broad and diverse set of stakeholders. We have people who represent business, who represent law enforcement, and healthcare, all people all over. So that I can say with other COCs, not necessarily the case. It's kind of surprising. If you look at the board list or the membership list of other COCs, we are very, very, we're very broad. We have a dedicated provider network who have been around for a while. And so lots of expertise there as well, and also a lot of passion. And we do collaborate when things happen and we have crises occur, which we do. We are able to get together and figure that out. And so that's a great thing about our COC too. There are resources, rapid rehousing was mentioned, of course, homeless population sensitivity. We have leadership within the homeless population, people who have lived experience who can talk about what it's like and also be in leadership to tell, what policies need to change or what works and what doesn't, and actually have that input put into action or implemented. And we show a willingness and desire to improve, which you have to start with that. Okay, let's go next. These were some other strengths. I did not come up with these, so I'm going to skip the first one, but that was one. Then we have a functional coordinated entry. Our permanent supportive housing, the existing infrastructure we already have for that, investments that have been put in those over the years. Our provider network, again, was mentioned, and a desire to strengthen practices. Let's keep going. We're going to have like 10 slides of strengths here. Okay, opportunities and enhancements. So some opportunities were to examine, and these were themes that came out of those the surveys and the interviews. Examine and incorporate COC best practices. So what best practices exist out there that we may want to implement or consider? And then also, I would say, there are some best practices that we have as well, because we do receive a lot of connections from HUD technical assistance, connecting us to other COCs because of things that we do that are pretty awesome. So we need to always make sure to remember that we're doing good too, so that doesn't go away. Improving our board and governance practices, so stabilizing that, reviewing and updating the governance charter, and investments in prevention and diversion were areas that we could enhance according to the responses received. Okay, let's go on to the next.
When are
Is it-
questions appropriate?
Teresa, you can ask a question.
Thank you.
Mhm.
On the last slide, it mentioned something about stabilized governance. Can you expound upon that, please?
The word stabilize, so this came from those surveys again. So I wasn't and interviews, and those were kept confidential from me. So I can't exactly state what stabilize was. I think, but improving the board practices, what came out of that and landed in the plan had to do with having understanding of what board responsibilities were, and also that was the big thing. So having good like a job description. What is it? What does it mean to be a board member? What's expected of you? And the second part was looking at a board evaluation. So like a self-evaluation. To examine, evaluate those, whether or not governance, making sure that everyone on the board is aware of what's in the governance charter and does it still work. Those were connected.
Thank you.
Thank you. Of course, expanding housing options and investing in housing is going to be in there. Increasing supportive services and partnerships, and in particular with hospitals and healthcare. That is something that we've discussed for well over a year now. I would say, yeah, about a year and a half at least. And we've also discussed within the last year about some legislation that was coming down that Pinellas County, Pinellas County, the HLA and CLC have been working with some representatives of the state to look at ways to increase those relationships between hospitals, and especially in discharge planning. And it would help, right now that is a vacant seat. Improve supportive services, coordination, and system integration. So cross systems is not just the homeless system, but then we like the healthcare situation. We share a lot of the same people and the same values, and working together so that it's not so siloed. And then strengthening data-driven system capacity and application. And I believe, so capacity meaning that we have enough staff and we have enough support and resources to have very robust data, but also applying it. So when the data are sent, when the data are available, are we using those data to do something with them? Or are we basing decisions on other things? Active lived experience engagement and advisement. So we've had an incredibly active lived experience advisory committee, and we're working on the youth advisory board as well. We have board members who have lived experience, executive committee members who has lived experience. And those are the people who have at least disclosed that too. So that is pretty remarkable. And of course, another best practice is making homelessness rare, brief, and non-recurring. And so preventing the influx, looking at inflow and outflow, making sure that that is moving, that it's real-time prioritization would be ideal, that people are rapidly exiting homelessness, and that they are not just exiting, but they are stabilized for the long term. So there's not this revolving door, that people are able to make it through and not have to come back into the system again. There are so many best practices. Multidisciplinary outreach. In here, we do, and many of these we do. This CoC does. So this is not to say that these are all gaps. Case management, with behavioral health, that does definitely occur. We have many programs that do that. Can we have more? That's the question. Peer support specialists. It was another area to look at, and resources that are investment, tying those to outcome measures. So that goes back to that data application piece And are we continuing on with programs and we continuing on with funding decisions based on outcomes or for other reasons? And how can we beef that up? Okay, next. Okay, so the priorities that came out of all of that, it came into 3 basic buckets. So COC operational resources and processes, the systems framework, and recognition and trust. These were very huge. Okay, sorry. Like I told everybody, I'm in a hospital. I'm just making sure someone knocked on the door. Okay, we're good. Some of the goals so the primary goals of the strategic plan, and if you look at it, these are on the very top. The strategic plan is also laid out to where at the first or second page, create the brief synopsis of the whole plan. And then you go into it in the remaining pages to see what those specific actions are and who leads them. So one of the goals is to reduce homelessness in Pinellas County, Florida by 10% between 2026 and 27, and by an additional 10% the second year. So this is a 2-year plan, first year 10%, second year 10%. And the same for increasing unsubsidized housing stability because unsubsidizing, that is a HUD priority, is for people to be able to find self-sufficiency and without services and benefits. And so to increase that stability by 10% this year and then another 10% next year. There was a discussion, and it is in the strategic plan, but the discussion at the work group was that how can we be held to these percentages? These are all reliant on funding and resources being made available. And of course, there's more, it goes beyond that. Also, the decisions we make as well as the COC will help drive this. Okay. Okay. So these are basically, we can go to the next slide. Those are restating in a little bit more depth. Okay. So in the strategic plan, and that was attached to the agenda packet, and it's also online at the PinellasCoC.org website under governing documents. In that plan, you will notice responsibilities. It really is, this was done intentionally. I didn't do it. This is the facilitator. This is how, through the discussions in the work group, it's driven by committee work. Committees get together to do that work so that the board can then approve it, or the COC membership can approve things that move forward. HLA alone, of course, cannot do all this work by ourselves. We're too small, and it wouldn't be as wonderful as with all your brains. So each committee has some strategy and action given to it, an assignment as part of their work plan for the next 2 years. And so I really encourage, review that strategic plan and look at PinellasCoC.org or reach out to us at HLA. Talk to a committee chair if you would like, and see if there's a place where you can plug in, where you have certain gifts, skills, abilities, talents, interests. If something really is sparking you, that there is work, there's plenty of work to go around, and it could be small or big, so it doesn't have to be a heavy lift. The more of us doing it, the better, and just bring those gifts in. And so if the best way to see this plan through is to join a committee and start tackling these areas. Each piece has a timeline associated with it. It is very ambitious. We ran it by our HUD technical assistance provider. She said, it is ambitious. You absolutely do need all hands on deck for this. So it's going to take all parts of our COC to make this work. Are there any questions or discussion? Anyone with your experience, if you were on the work group or participated in any other way? Okay. And I want to make sure is that if there's anything in the chat.
What do we need to be part of a committee? If that's something you can post or?
Yeah. If someone will, from HLA, if you will, please go grab the join. Well, first you have to just be a CLC member. And then to join a committee, there is a committees and councils page on the PinellasCoC.org website. And I would do it, but I'm used to 3 screens in front of me right now. I have a small one. So if someone on my team will go ahead
No
and
problem.
post that for us.
Thank you.
Thank you. There it is. There, well, that's the members. So that's the way to join. And then also for councils and committees. And then Elise, if you'll go ahead and put up the strategic plan too, that'd be great. The link to that. Any other questions or comments? Okay. Well, it's a lot to do for 2 years. So looking forward to hearing from you all and seeing you get active. And we do have many people who are very, very active and passionate. So I'm sure that we can we'll do a brilliant job. And with that, I'm going to pass it on over to Avery.
Yes.
There you
Hello.
are. Avery Sliker. How are you? Dr.
Great.
Sliker. Okay.
Thank you so much, Sherry. Good evening, COC. Thank you so much for allowing the city this opportunity. Helen is on the line and she's going to jump in here when she needs to or when I miss something. We are very excited to bring to you what we call the first of many sessions on the housing opportunities for persons with AIDS funding. Go ahead and go to the next slide. So this was created through the AIDS Housing Opportunity Act. This is the very first and only federal program that is solely dedicated to housing for people with HIV and AIDS. The goal of this program is to do the connection that we all know is needed, that connection between the foundation of medical needs and housing. There is dedicated federal funding for individuals living with HIV and AIDS, and there is no other funding stream for this. So how did we get here? HUD recently designated Pinellas County as an eligible metropolitan statistical area. That is an EMSA. Yay, we get new acronyms. And with that, that is based on your CDC HIV surveillance data. The cumulative cases that they built this on for Pinellas for AIDS was that we're at 15,155 with 3,200 new cases each year. We currently have the number of people living in Pinellas with HIV as 4,667, and with new cases averaging around 122 per year. Currently, the city of Tampa holds the funding for HOPWA for Pinellas County residents. With this new designation, the funding will come to the city of St. Petersburg. So this means that this funding is not just for the city of St. Petersburg residents. This is for Pinellas County residents that we will be serving. What we're going to be doing over this first year is we are going to be transitioning the program between the city of Tampa and ourselves. So the city of Tampa had already been through their competitive process for HOPWA for this year. And what we've determined to do through HUD is that we are going to contract with the city. They are going to maintain and manage those contracts this first year while we finish our planning. And then in January, we will have our open competitive process for our annual action plan. HOPWA will be incorporated into that. The only difference between the HOPWA program and our Community Development Block Grant, Emergency Solutions, or Home Investment Partnership Program is that those are 1-year contracts. This would be a 3-year contract. The funding for HOPWA for the city is for 3 years. And right now we have approximately $1.7 million. Next slide. So, back one. There we go. Who qualifies for HOPWA? Who qualifies for HOPWA is somebody's HIV status, where at least one member of the household has documented proof of an HIV or an AIDS diagnosis. That is what establishes program eligibility. It does serve clients with low income not to exceed 80% of your area median income as determined by HUD, who are homeless at risk of becoming homeless. And there needs to be a demonstrated need. So there has to be a need shown that's needed for the housing and the financial assistance. Teresa.
Thanks, Avery. My question was related to the definition of a household, and where I'm going with this, could it be the person, obviously a family with children, and the adult has HIV or been diagnosed with AIDS, or could it be two partners who are not necessarily married that live
Yes, ma'am.
together? Okay, thank you.
Yes, ma'am. The HOPWA program is fairly flexible right now with its definitions, so it is a household. Okay, next slide. So here are our key program components that we can deliver. There's long-term rental assistance that provides participants the leasing housing opportunity in a private market, short-term financial assistance for rent, mortgage, or utility costs that's going to prevent the eviction and a costly system entry. Housing programs that can be supportive facilities, transitional housing, or permanent housing, all funded through the HOPWA program. Assessment, navigation, landlord engagement, housing search, referrals, case management, and other services that are going to help somebody maintain housing stability. There's also financial assistance and services to help people move into that permanent housing. Next. So how does HOPWA coincide with the CoC alignment? Well, the programs that we serve overlap populations. You know, low-income individuals with HIV and AIDS who are experiencing at risk of homelessness, or they are homeless. We work in tandem together. HOPWA funds complement CoC resources. This maximizes our housing capacity as a continuum of care. Now, critically, HOPWA is the dedicated funding stream to reduce the pressure on the continuum of care for your permanent supportive housing and preserving those resources that are deeply needed for a broader homeless population. Next. Ways that we intersect. A coordinated entry. Providers can be integrated directly into our local coordinated entry service. HMIS data integration. Now, this one's interesting. We're going to learn a lot more about this on Friday, Helen and I are, with HMIS, because HOPWA is treated similar to that of domestic violence survivors, where that data is privatized. It would not be open data. And then joint case management. Continuum of care and HOPWA staff collaborating across housing and medical adherence goals. That's what the goal is. Next. Here's what our current proposed funding would look like for this first year. We currently have 3 providers that serve Pinellas County HIV and AIDS individuals. So that would be Foley, who provides the tenant-based assistance. You have Metro Health Communities that does supportive services and housing assistance, rental assistance. Epic, who does the supportive service and also does the TBRA, the tenant-based rental assistance. This is what their budgets would look like for year 1. Would not be what they look like necessarily for year 2. or anyone's budget for year two, since year two will be competitive. Next slide. What Helen and I are going to be doing over the next few months, as well as other city staff, are holding listening sessions. We want to know, what are the current housing needs for persons with HIV and AIDS? Where are the gaps in services? What successful practices? What have you heard other communities doing? Opportunities that we can improve upon what we currently do? Priorities for future investments, and trends. What are some of the trends affecting individuals living with HIV and AIDS? Next. We need to know who the partners are that are out there that we haven't touched yet. Who are we touching that maybe we don't know serve this population? What are those challenges that they are having? These sessions are designed to gather the input from the CoC members, housing providers, service providers, healthcare providers, people who lived with experience, and other stakeholders. This information is going to help us develop our assessment and our needs for future planning. Next slide. That's where we're going to ask you to please share your thoughts with us. Please snap a picture of the QR code. It will lead you directly to a survey for us. The survey is very short, and it's asking that critical question. The critical question of, what is the single most important issue facing individuals with HIV and AIDS in needs of housing? Helen, did I forget anything?
Nope, you did. You did well, all as well. I would just say that as you're filling out the survey, I know the question is there, and I know we asked you specific questions within the survey, but if you'll just keep that in mind, ultimately that is what we are looking for. What are we missing? What gaps can we fill in our community? Could be different than what we are currently funding. The one thing that I would say, Avery, I guess if it's 1 year already with City of Tampa, would it then be 2 years?
That is what we need to find out. And I'm very
Right.
sorry, everybody, that it's not working. I tested it earlier today and it did work.
Yeah.
So I will get that for you and post it.
Mine was working earlier and now it's not.
Okay.
Okay.
I will get the link for you all, hopefully by the end of this call.
Any questions for us?
I just wanted to say that I tried the link, and when it says open in the app, there is a section underneath that says without the app, continue in browser. It's light gray, so it's hard to see, but if you click on that, then it does take you to the survey.
Thank you, Alex,
You're
and I
welcome.
will get it. Thank you. No questions at all?
Avery, can you email us your PowerPoint? Because, for example, I know I'm on my phone, so it's hard to scan a QR code when you're on the phone. But if you could email us that, then we could scan it from that document.
Absolutely, I will, Teresa.
Thank you.
Yes, HLA has it, so it can be
Okay.
sent out to anyone.
All right. Thank you.
And I guess I would, for the HLA and for all of our providers and everyone on the call, I would double click on that. We really need to get a good idea of what the community thinks is needed and feels is needed for this. We will be doing these listening sessions with the Lived Experience Committee, and probably we've already done funders, providers, council, but we will be trying to get out to everyone. So if there are other people that you want to pass it along to that are in our community, work in our community, and have some insight into these needs, we'd be happy to hear from them as well.
Oh, thank you, Dominique.
Thank you, Dominique.
And additionally, if you would like for us to come out and just speak with your community, whether it be your organization or you have another volunteer group that you work with outside of the continuum of care, please let us know. We would love to do that. We do work with the Ryan White Regional Council, so we will be doing a listening session there also. Thank you.
Thank you. And I just want to, Alicia had put in chat that the presentation, along with the QR code, will be uploaded into the community calendar. So that's the community calendar that's on PinellasHomeless.org. You can access it through, well, also the PinellasCoC.org website as well. And if you look today, it will be put in those, put on that calendar very shortly. And then we'll be sending it out too by email. Thank you, Helen and Dr. Sliker. And appreciate your hard work on the review and rank committee too. I want to say it again. Thank you. So next,
Sherry, I'm sorry. I
yes.
did see a question in the chat. Do you have a list of where offering the listening sessions? We do not have a list at this time, but if you, we do know we'll go to Lived Experience Committee in September. If you have somewhere that you would like us to go, feel free to drop it in the chat. And or I don't think either one of our information was on there, but I will drop my information in the chat. You can send that to me, and we'll be happy to have someone from our team present. You're welcome, Carrie.
Okay. And there's some contact information. There we go. Very good. Well, so upcoming elections. In the past couple of years, the elections have taken place where we had the general membership meeting immediately prior to the January CoC board meeting. And this year we want to get on a better schedule. And so the goal right now is we have the nominating committees meeting this month and reviewing what is in the charter as far as, like timelines for the election, how much notice needs to be given, who gets to be in the election, who gets to be a candidate, and they're reviewing the nominating procedures. And so just note, be on the lookout for that call for nominations. You can nominate yourself. That is the primary. You don't have to nominate someone else. In fact, typically people don't do that. They nominate themselves, fill out the form when it comes out, and we would anticipate that being sometime in September, October, because the election will be in November. So election in November so that members can be oriented and ready to go in January for their first CoC board meeting. And I just believe that'll make for a smoother process. So definitely be thinking about it. We're also going to be sharing vacancies with the nominating committee and making those announcements as well, so that people know where the need is. I'm going to pass it along to any other questions, answers, comments, or if there are any resources or things happening out in the community right now that you would really like to share with the rest of the membership from your own organizations or community. I'll break the seal. We have info session. A CoC info session will be on September 8th at 5:30 p.m. And the topic is going to be transitional housing because that is a big priority moving forward. And I know there's been a lot of conversations within the CoC about what is transitional housing. You will be able to learn more about that at that meeting. It is 100% virtual.
Jen?
Ms. Kerr has her hand up.
Yes, Ms. Kerr.
My question is, how many people are on the board?
It varies between 19 and I think 31 is the max. Don't quote me on that top number. But that is the In the charter, that is the range.
Big.
Yes.
Mhm.
Arrow.
Hello, I was wondering if Dominique's still on here, if he wants to give any update on the plans and he wants to kick off.
On the point in time count kickoff?
Yeah, thanks, Arrow.
Yeah, right.
Hi, everyone. Dominique Randall here. I work for Pinellas County Human Services. I actually also have the pleasure of being the chair for the Point in Time Committee. So that is one of the committees mentioned by the COC. And we meet the first Monday of the month. We just kicked off in August. This is a seasonal committee, I call it. So we meet August to early March this year. And we prepare for the point in time, which was the report Sherry mentioned earlier, but it is a one-time annual snapshot of a census of those experiencing unsheltered and sheltered homelessness in Pinellas County. And so it is an all hands on deck activity, and we survey individuals across the entire county at the end of January. We'd love to have anyone join us and participate either in one of our committees or subcommittees. We like to partner with first responders and law enforcement. We're looking at unaccompanied youth and how we can specifically target them. Also, where to deploy, where to go throughout the community to make sure that we really are gathering the best census that we can on those who are unsheltered. And then things like the survey and some other, I'll also mention fundraising and marketing. That is a big need for the COC for this event this year. So if anyone has any skills or interest in that, we would love to have you join us as part of the larger committee or at some of those subcommittees.
Thank you, Dominique. I just want to add that point in time count is required by HUD, at least to be done biannually. We do it annually as a COC, and that feeds a lot into our funding, and it's a big deal. It goes to Congress in an annual report, and so all that data. So very, very important work. And also, it is one night point in time. But one thing that I found really helpful about point in time count, or amazing about it, is that opportunity to get around someone but in a structured conversation, right? It would take away a little bit of the awkwardness, someone that you may never have met before, and have a conversation. And so that's community building. So definitely anyone who is interested in being part of that, Dominique would love to have you on the committee. We all would. Or a subcommittee. And she's provided her email address. Anything else?
Before we do close, I do have an announcement that I would love to. First of all, thank you again, Ms. Helen and Dr. Sliker for the presentation. Of course, you know I'm somewhat biased. The city of St. Petersburg definitely tries to do what they can to accommodate a community that we all love and want the best interests to serve. So with that being said, I also want to invite those on the call, if you would like. I don't know how many of you all remember the Wraparound Services Collaborative that Delquanda Turner and I actually started in 2010. Well, we will be meeting again tomorrow at the President Obama Library from 11 to 1. Actually, it's 11 to 12:30. But this particular topic is resiliency in the midst of changing times, because we do know from now to the next time that we possibly meet, we all have to have some very strong and difficult funding conversations within our organizations. And so for that particular conversation tomorrow, we do have Duggan Cooley from the Pinellas Community Foundation as a funder. We do have Dr. Renee Flowers from Pinellas County Commissioners. We do have Rebecca Gross Teeter from the Juvenile Welfare Board. We do have Leah McDermott from the Florida's Nonprofit Alliance, and Tom Green from the city of St. Petersburg will be there to answer questions. So as we try to prepare for the next 2 or 3 months here locally, just wanted to invite you out to the library tomorrow at 11 o'clock. Other than that, thank you. Great informative meeting today.
Thank you. Thank you for sharing that opportunity too. Okay. Are we ready to close out?
Sounds like it.
I think so. Okay. Well, everyone, you have a wonderful rest of your evening, and we hope to see you in September for the information session on transitional housing.